Our presentation is on the drugs in the treatment of ADD and ADHD. ADHD is a condition and stands for Attention Deficit Hyperactivity Disorder. It was previously called ADD, which stood for Attention Deficit Disorder. It is a neurological disorder which is commonly diagnosed in children, which affects the way they control their behavior, sit still, and pays attention. Some of the symptoms include hyperactivity, impulsivity, and inattentiveness. ADHD is a disorder that cannot be cured or prevented, but if you recognize the symptoms early enough and have a good treatment plan and education plan, you can help manage the symptoms. Stimulants are considered to be the most commonly type of prescribed drugs in treating ADD and ADHD. In the class of stimulants, the two drugs that are often prescribed for ADD and ADHD are Adderall and Ritalin.
Action and treatment of Adderall. Adderall is designed to improve hyperactivity, impulse behavior, and attention span. Adderall is a mixture of 4 different amphetamine salts: dextroamphetamine saturate, amphetamine aspartate, dextroamphetamine sulfate, and amphetamine sulfate that is used to treat attention deficit hyperactivity disorder, also known as ADHD. The medication alters certain naturally occurring chemicals in your brain by enhancing the effects of neurotransmitters such as dopamine and norepinephrine. Some patients feel that Adderall has less of a drop-off effect than Ritalin, which means fewer side effects as the medication wears off. Also, a dose of Adderall is typically longer lasting than a dose of Ritalin. Action and treatment of Ritalin. Ritalin helps to improve the same effects Adderall does, such as hyperactivity, impulse behavior, and attention span for people who have attention deficit hyperactivity disorder. Ritalin has been shown to act as a norepinephrine and dopamine reuptake inhibitor, also known as an NDRI, thereby increasing the presence of these neurotransmitters in the extraneuronal space and prolonging their action. Ritalin works sooner and reaches peak performance more quickly than Adderall does.
When it comes to comparing the two medications, there are many similarities. The only real difference on this chart is between the generic names, Adderall being either amphetamine or dextroamphetamine, whereas Ritalin's generic name is methylphenidate. Between these medications, the similarities are that they both have generic versions available, the uses are primarily for ADHD and narcolepsy, and that they have short and long-acting tablets or capsules available. Both also share the length of treatment, which is long-term. On this chart as well, you can see that Ritalin and Adderall share a lot of the same characteristics, the first being storage temperature, which is between 20 and 25 degrees Celsius. They also are both controlled substances, have the risk of withdrawal, and the potential for misuse. Although they share many similarities, the available strengths that are offered are where they differ. To start, Adderall has tablets that range from 5, 7.5, 10, 20, and 30 milligrams, but there are also extended release capsules. This means that the capsule is formulated to release slowly over time, which gives the advantage of taking the medication less often throughout the day. These extended release capsules range from 5, 10, 15, 20, 30, and 36 milligrams. With Ritalin, there are regular tablets that range from 5, 10, and 20 milligrams, as well as long-acting capsules and sustained release tablets. The long-acting capsules are similar to extended release ones in that they work by releasing throughout the day and in phases, as well as they give the advantage of taking fewer pills. A subtle difference between the two is that extended release capsules tend to drop off in their capabilities throughout the day, whereas long-acting capsules are more apt to continuously release the same amount throughout the indicated time. These capsules come in 10, 20, 30, 40, and 60 milligrams. The last type of tablet on this chart is sustained release tablets, which come in 20 milligrams. In comparison to the previously mentioned types of time-release medication, sustained release tablets are also released slowly, and they have the same advantages as mentioned before.
While taking these drugs, some of the most common adverse side effects include headaches, stomach aches, a decreased appetite, irritability, insomnia, and some may even contribute to the risk of developing a heart problem or psychiatric problem. Some of these psychiatric and heart problems can include psychosis, bipolar disorder, heart disease, high blood pressure, and irregular heartbeat. But these are all considered to be more of the long-term effects of taking Adderall and Ritalin.
With the dental concerns and considerations that come with taking Ritalin and Adderall, they end up being very similar. The two most noted concerns while taking stimulants are both bruxism and xerostomia. When it comes to bruxism, in most cases, the grinding is occurring at night when the client is asleep, although it could always be happening during the day as well and being multiplied by daily stress. Mild bruxism may require no treatment at all, but if severe, can cause headaches, jaw pain, and damage to the teeth, as well as dental restorations. The main treatment that you could offer a client exhibiting bruxism would be a night guard to prevent the damage from progressing any farther, as well as taking some pressure off of the jaw. Many medications pose the risk of a client developing xerostomia, so seeing this is not much of a surprise. Although we know that xerostomia can put the client at risk for many other dental issues down the line, such as caries, inflammation, sensitivity, and halitosis. If a client is exhibiting xerostomia, it's important to review the options they have to combat the effects of their prescription is having on their mouth. This can range from an increased water intake, chewing sugarless gum, and recommending the use of artificial saliva products or saliva stimulants.
Oral management implications for children with ADHD. Dental hygienists are likely to encounter children and adolescents with ADHD. Poor toothbrushing and frequent snacking habits are more frequent in affected clients. In particular, children with ADHD tend to brush their teeth for a shorter duration than children without ADHD and are more likely to have a history of assisted brushing. Children with ADHD require rigorous preventive oral care, especially during adolescence. This will help address the tendencies for poor oral hygiene and oral health behaviors. Behavioral management challenges may be posed by clients, which in turn affect treatment strategies. Parents of children with ADHD may be more likely to perceive that their children dislike visits to oral health professionals than do parents of non-ADHD children. Short morning appointments are generally recommended. Fatigue may be experienced later in the day, compounded by possible wearing off of medication. This makes it more difficult for the client to sit through the appointment and listen to instructions. When treating children with ADHD, distractions in the office should be limited. To reduce distractibility of the client, music and earbuds or television can be utilized. It is also advisable to discuss with the child what the appointment will involve to avoid surprises.
When it comes to follow-up medical history questions, we would most likely start by asking whether or not the client has been experiencing any adverse side effects from their medication. Of course, we would focus on the dental-related side effects, but there could also be a large range depending on the specific medication they've been prescribed. Asking how long a client has been taking the medication is also important, because if they've been on it for a long period of time, it's fair to assume that there have been little to no complications with it. In comparison, if they are new to taking this drug, it may be worthwhile to ask how they are feeling it's affecting them overall, whether or not they find any changes in their day-to-day life, or if they're having any troubles with it. Asking the client about the dosage they have been prescribed and how occasionally they have taken their medication goes hand in hand. Depending on the dose, it could be one of the time-release types that we talked about earlier, meaning that they are taking the medication less often throughout the day. It is also important to ask the client if they've been having any cardiovascular complications since being prescribed this medication. It would be very rare that the client did not bring up any heart complications in their original medical history, but stimulants can raise your body temperature, blood pressure, and heart rate, meaning that some clients on their ADHD or ADD medication are required to have regular appointments with their doctor checking up on these things.
And these next two slides are our references. We hope you enjoyed our presentation on drugs in the treatment of ADD and ADHD.